Hello, my name is Jennifer Zigrang. I am a nurse practitioner student with Maryville University. This is my head-to-toe examination video. This is my patient, Jessica. She is alert and oriented. She's a well-nourished, well-appearing young adult female. She answers questions appropriately. Her gait is steady, and yeah. I did have her empty her bladder before we put on a gown. We did a full set of vital signs. We did her height and her weight and a Snellen eye exam, which she got 20/20 both eyes and together. Okay, we're going to start off with the head, Jess. I'm first just going to look at the head and the face, looking at the symmetry of the facial features, making sure there's no obvious deformities, and there doesn't appear to be any. I will then go ahead and palpate her scalp and her hair, looking for the texture of the hair, making sure it's not brittle, that there's no split ends, that the follicles themselves are do not come out easily. There's no alopecia. There's also no swelling, no lesions, no rashes that I'm aware of. I'm then going to have her do a series of facial movements to check the cranial nerves. So Jess, would you grit your teeth? Okay. Wrinkle your eyebrows. Squeeze your eyes shut. Puff your cheeks out. Stick your tongue out. And smile. Very good. All right. I'm then going to palpate the facial bones themselves, making sure that they're all symmetrical side to side. There's no step-offs. There's no obvious deformities or any signs of fracture or trauma. I'm then going to palpate the sinus regions, the frontal and the maxillary, making sure that there's no swelling, there's no pain with palpation. We'll then move on to the temporomandibular joint. If you'll open up your mouth and close it and open again. Okay, I'm checking for the muscle tone, making sure that's all good and toned. She has good muscle strength. There's no pops or clicks in that temporomandibular joint. Okay, I'm then going to check her light sensation. This is another cranial test. If you can tell me if you can feel this equally on both sides of her forehead, cheeks, and chin. Very good. Okay. All right, well then go ahead and move on to the eyes. I'm going to first inspect the outside aspect of the eyes, making sure that everything is symmetrical, that there's no obvious deformities, there's no ptosis, there's no drooping, there's no matter. The eyebrows themselves, the hair is distributed evenly, and both sides are symmetrical. The eyelashes themselves extend upward and outward. There's no matter. The sclera themselves are nice and white. There's no yellowing or jaundice. There's no erythema. I'm going to check the conjunctiva. And it's nice and light pink. It's not too light, not pale, indicating anemia or anything. And there's no erythema. And also there's no exudate. Now I'm going to check her pupillary response, okay? So just look at my finger here. I'm going to check the direct, and then look at the other side in consensual, and do the other eye, direct, consensual. Very good. All right, I'm going to have you look at a spot out there. I'm going to cover one eye, and then go ahead and uncover. Okay, and then do the other eye, and uncover. And there again, I'm checking to make sure that there's no jumping, nystagmus, anything that might indicate some ocular motor dysfunction with her eyesight. We're going to go ahead and check the cardinal vision fields now, if you'll follow my finger. Very good. All right, and now we'll check the peripheral vision also. Tell me when you can see my fingers move.
Now.
Okay, very good. We'll go over here.
Now.
Okay. Very good. And then if you can follow my finger inward, accommodation is very good. I'm also going to palpate the orbits themselves, making sure that they're not too hard That would indicate some intraocular pressure. And also the lacrimal apparatus, making sure there's no swelling or pain or erythema. Okay, we'll go move onward to the nose. I'm going to have you tip your head up. I'm going to look inside the nose, looking at the hair distribution, the mucous membranes, the turbinates, the septum itself, making sure there's no abscesses, there's no bleeding, there's no drainage noted on the back of her nose, and everything looks good. Can you go ahead and cover one nostril, breathe in and out, and then the other one. Very good. And both nares are nice and patent. Okay. We'll move onward to check the ears themselves, okay? I'm going to check the outer aspect of the ears, making sure the alignment is good. We're looking at a line from the inner canthus to the occiput, and the auricle of the ear should sit above that, and it does in both sides. They're all nice and symmetrical. I'm going to palpate the auricle, making sure there's no nodes, nothing abnormal about that. I'm also going to check behind the ears themselves to make sure there's nothing abnormal. I'm going to look inside the ear, making sure that the tympanic membrane is pearly gray and that the canals themselves are open with no wax buildup. The tympanic membranes, of course, are pearly gray, and there's no bulging, which it could indicate some buildup of fluid. So that looks all good. We'll go ahead and do the whisper test now. I'm going to go ahead and say a word, and you tell me which word I say.
Pineapple.
Very good. Other side.
Orange.
Very good. All right, we're going to do the Weber test now. This is where I put this on top of your head, and you tell me if you hear it in one, the other, or both ears.
Both.
Very good. Okay, and we're going to do the Rinne test now, which I'm going to put on the mastoid bone, and you tell me when you stop hearing.
No.
Okay, and then tell me when you stop hearing.
No.
Very good. And that's just checking the whether the patient hears better through conduction through the air or the bone, and the air won, so that's very good. Put this away. All right, we'll move onward to the mouth and the pharynx. I'm first of all going to look at the lips themselves, make sure they're nice and pink, they're moist, there's no cracking, there's no lesions. Can you open up, Jess? I'm looking at the tongue itself, making sure it's all consistent, that there's no lesions there, it's nice and pink and moist. There's no yeast. I'm looking at the buccal membranes and the teeth themselves, the dentition, to make sure there's no obvious caries, that she hasn't lost any teeth. The teeth are nice and white. And the gums themselves are nice and pink with no areas of erythema or like paleness, which could indicate an issue also. Go ahead and say ah.
Ah.
Very good. Okay, as she says ah, the soft pharynx or the soft palate lifts up. That is very good. The hard and the soft palate are intact. I'm looking at the, go ahead and say ah again.
Ah.
I'm looking at the tonsils and the posterior pharynx, the pillars on each side. Looking at the tonsils, the uvula itself, making sure that's midline, and everything looks good. I'm going to go ahead and do the gag test now too. The okay, and the gag test is intact. Very good. Okay. I'm going to go ahead and look at the neck now, making sure that it is midline, it's in good alignment with the rest of the body. It's all smooth. There's no obvious deformities. There's no jugular vein distension on each side. I'm going to go ahead and palpate for the carotid on both sides, and they're nice and even. I'm going to go ahead and palpate the trachea and the thyroid. And can you swallow, Jess? Okay, swallowing is intact. The thyroid has no nodules that I can feel. It's nice and smooth. I'm going to go ahead and do palpate the the glands, the lymph nodes themselves. So these are the pre and post auricle, and the occipital back here, the tonsillar, the submental and submandibular. Go down to the superficial cervical chain and the posterior cervical, the deep cervical, and the supraclavicular. And I do not feel any nodal swelling. There's no lymphadenopathy. Everything looks good. We're going to do the range of motion for your neck now, Jess, if you can, yep, back and forth, and yep, very good. Okay, now I'm going to do it for you, and I'm looking for any crepitus that I might feel, and then go ahead against my, yep, we're testing the strength now. Very good. There's good tone, there's good strength through her neck and her upper area here. So can you do the shoulder shrug for me? Very good. And there's good strength that way too. And this is also another one of the cranial nerves, okay? I'm going to auscultate now for any bruits that might be heard in her carotids. And just take a deep breath and hold. Good, and we'll do the other side. Good, and then I'm going to check your thyroid and take a deep breath and hold. Good, and I don't hear any bruits whatsoever. We're going to go ahead and do the upper arms and the shoulders. I'm looking at the skin and the distribution of the hair, looking at the temperature, whether the skin is nice and pink and warm and dry. We're looking at the nail beds themselves. Capillary fill is brisk. Both hands, there's no edema, cyanosis. There's no clubbing that I can see. We'll do the strength. Can you squeeze? Okay. And then push up. And then down. Very good. I'm going to do the pulse points now for the brachial and the radial. Very good. Okay. We're going to go ahead and inspect the back now. If you can go over this way and just kind of dangle your legs. There you go. We're going to inspect the back. Looking at her respirations, seeing if they're labored or not, if she's using any accessory muscles. We're going to do the diaphragmatic excursion, if you can breathe in and out. Okay, very good. And we're doing it on the 10th rib, and it looks like it's nice and even. Both sides are symmetrical for the amount, and it's got a good excursion expansion. We're going to listen and feel for tactile fremitus. If you could say 99.
99, 99, 99, 99.
Very good. We're also going to palpate and percuss the costovertebral angle. Sorry. For any pain or tenderness. Anything there, Jess?
No.
Okay. We're also going to percuss systematically across her back, along fields, listening, side to side, and then also the lateral, making sure that there's no dullness, anything that might be different from side to side. If you can lean forward slightly, okay, take a big deep breath for me and hold it. Okay, I'm going to take a mark there. Okay, now we're going to breathe all the way out and hold it. Okay, now those 2 marks that I made, I'm going to measure, and it should be between 3 and 5 centimeters for the diaphragmatic excursion, and it is, and it's perfectly normal. So we're going to go ahead and auscultate in all the lung fields, and in and out, and we're listening for any rales, any adventitious lung sounds. We're comparing side to side. Sorry, that's cold, I know. And listening for any wheezes, anything that should be abnormal at all. Make sure this stays on here. All right. Go ahead and stand up. We're gonna, yep, sit. just sit right here. We're gonna look at your front now. We're gonna do the same thing. We're gonna look at the respiratory effort, like making sure that there's no accessory muscle usage, the skin, everything that, making sure there's no lesions, no rashes, no moles, anything like that. We're also going to look for any heavings or pulses that we can actually see on the chest wall from the heart. And I'm going to also feel for any heavings or pulses or thrills. And I'm also going to feel for the apical pulse on the 5th rib. Okay, and then we're going to do the tactile fremitus again, Jess. Can you say 99?
99, 99, 99, 99.
All right, okay, thank you. All right, we're going to go ahead and check her nodes now, the axillary and the infraclavicular, making sure there's no nodal swelling, no lymphadenopathy. I know, you're ticklish. All right, we're now going to go ahead and percuss across systematically again, side to side, making sure there's nothing different from side to side, looking for any dullness at all. We don't want anything that's different. And then I will go ahead and auscultate again the lung sounds. Okay. And then on the lateral aspect also. And we're making sure that everything sounds symmetrical from side to side, that we don't hear any adventitious lung sounds at all. I'm going to go ahead and auscultate the heart sounds now. And we're going to start with the aortic and the pulmonic. And the tricuspid and the mitral. And that sounds good. All 5 of the heart sounds sound perfect. I don't hear anything abnormal. All right, can you go ahead and lay down? We're going to look at your abdomen. All right, we're going to look at the contour of the skin. Look for any pulsations or movements that might be abnormal. Everything looks good. It's nice and flat. The skin is all perfect and symmetrical. There's nothing abnormal that I can see. All right, and we're going to go ahead and auscultate for bowel sounds. And everything is active. We're listening for any hyper, hypo, the quality, the tone, if it's high-pitched or low-pitched, indicating if there's anything amiss with air and fluid in the bowels themselves, or lack thereof. And we'll also auscultate for the arteries at this time also. This is the aortic, the aorta, and the renal, both left and right, and the iliac, and then the femoral. Okay, and that's listening for anything that could be abnormal side to side with a circulatory aspect. All right, I'm going to go ahead and percuss across the belly, listening to the sounds. And you can hear the difference between the denser the organ and the fluid filled. I'm going to do the liver borders now. I'm going to put a mark where I hear the difference of the tones. And then I'm going to come upward. And same thing, I'm going to mark. I'm going to measure, and that should be 6 to 12 centimeters is a normal range. And yeah, I would say that's about 6 centimeters, so that's very good. I'm also going to percuss for the spleen, and I'm going to percuss for any dullness. It should be tympanic. Any dullness would indicate some abnormal disease process with the spleen. Okay. At this time, I'm going to go ahead and do some light palpation on the belly. And we're doing circular motions. We're checking for rigidity, any muscle tenderness, guarding, any pain. And then we're also going to do some deep palpation. We're going to do the liver itself, and then the spleen, and the left and the right kidney. Very good. Sorry, Jess. We're also going to do some deep palpation with the aorta, checking for the the pulsation, which is just fine. Can you sit up just a little bit, Jess? Okay, and I'm checking for the abdominal muscle tone, and it's nice and tight, it's firm. I don't feel any hernias whatsoever. Go ahead and let's sit you up. I'm going to look at your feet and your legs now, if you will. Move this way. I'm looking at the symmetrical aspects, if there's any deformities, the skin itself, hair distribution, the temperature, if they're nice and warm, the cap refill of the toes, there's no edema, there's no cyanosis, everything looks good. I'm going to do the pulses now too, the popliteal, and I would do both sides, the post-tibial, and then the dorsalis pedis. And there again, I would do both sides, checking to make sure that the pulses are equal and strong. We're going to go ahead and do the strength now too. Can you push up and down and push up and down? And she's got good tone, muscle tone, and then you can, your touch sensation is all intact. You can feel that. Okay, very good. All right, we're going to go ahead and do the reflexes now. Can you scoot up just a little bit more? Okay. And do your brachial first, okay? Bend your arm. Good. And good. Good. So the knee and both the Achilles on both sides, we do the brachial both sides also. And those are all intact. All right. So we're going to go ahead and, if you will stand up, you turn this way. I'm going to palpate down your cervical spine here, looking for any deformities, any pain, tenderness, down your thoracic and your lumbar area. If you bend forward, and I'm going to look at the curvature of the spine, making sure it's nice and straight in alignment, that there's nothing abnormal, no scoliosis, that one shoulder or one hip isn't higher than the other, indicating an issue. And everything looks good. I think that concludes our examination. Thank you, Jessica. You've been a good patient for me, and thank you for watching. Have a good day.